Namaste. The Apollo Hospitals Health of the Nation Report 2026 is out, and it is an annual analysis of the health check data across Apollo hospitals designed to uncover early risks, emerging trends, and most importantly, opportunities to intervene before disease sets in. One valuable insight that we have got from the report this year is both concerning and also incredibly hopeful. We know that nearly 1 in 2 Indians under the age of 30 already have had one reversible risk factor, which could mean prediabetes, prehypertension, or borderline cholesterol. But here's the wonderful opportunity. Among those who tracked it consistently, made changes, and also came for follow ups and measured progress, uh, there was a remarkable reversal of disease with over 28% of under 30 pre-diabetics who reversed to normal, as compared to just 7% who were able to reverse when they did this over the age of 50. And consistent monitoring and care is the message that we are seeing here, that we see measurable improvement in hypertension, in dyslipidemia, and even in diabetes. So the younger you are, and these early signs are identified and addressed, the better the chance for reversal is one finding. To help us unpack this and to understand this much better, I'm joined by Dr. Vaishali Lokhande, who is a senior consultant and specialist in internal medicine at Apollo Hospitals, Navi Mumbai, who works closely with patients on NCDs, preventive health, and long-term risk reduction. So she's the best person to ask about this. Doctor, thank you for joining us. So when we see in our Health of the Nation report that nearly half of the individuals under 30 already have early risk factors, how do you view this? Is it a warning sign? And is it like a valuable opportunity for detection and reversal?
Uh, Good morning, everybody. It's an interesting question, and in fact, it depends on the way you look at it. In the health checkups, we see a lot of people below the age of 25 or 30 having fatty livers and borderline sugars, prediabetes, etc. In fact, they have strong family history, or they may be the first generation people who are presented with these conditions. If you look at it as an opportunity, definitely yes, because data says that if you intervene early, the chances of reversing diabetes in people below the age of 30 years is almost to the tune of 30%, provided these people are consistent, they are honest and sincere enough, and they are not just sincere, they're also compliant with the lifestyle. It's just that you don't do a health checkup and put the file away and then meet the doctor the next year. Doesn't work that way. You have to be tracking your numbers, and your you have to have a accountability here. That's where it works. So it's definitely an opportunity for people with pre-diabetes. In fact, I strongly advocate that. But and also people with fatty liver, if it's grade 1 fatty liver picked up in the early stages, reversal through weight loss, calorie restriction, monitoring is definitely there, because once it progresses to the grade 2 or the grade 3 fatty liver, where the fibrosis probably is setting in, which may not be visible on the regular ultrasounds, you already missed the bus or the flight, whatever you call it. So yes, I take it as an opportunity. What I've been seeing in health checkups is somebody this young getting pre-diabetes diagnosed, and if he or she is not understood the importance of it enough and is not compliant enough, the next 3 to 4 years, rest assured, they are going to land up in proper diabetes. In fact, if there's a delay, the chances of diabetic retinopathy, diabetic nephropathy, which are very silent in the beginning, already set in. The glucose toxicity of the pancreas causing beta cell loss, where the insulin is produced, definitely goes down, and it becomes kind of an irreversible stage, and microvascular complications do start right away. So it is concerning, but if you have the right approach to it, and if the people are aware of it, conscious enough about it, and willing to go that extra length for their own sake, I think it is an opportunity, uh, depending on how you take it.
So, as you say it, it looks like, first of all, people should realize that these things are striking earlier and earlier. And then I think they need to take the proper screening and then also look into correcting those numbers and not just putting the files away. Thank you, Doctor. So, what do you think is the reason why, these diseases, why is early stage generally more responsive to intervention? Why is there such a big difference in what people can reverse at a later stage or even a later age? I mean, those are two different things. So please explain to us why.
I think the best example of this would be diabetes, where you have this something called as a legacy effect. So legacy is what you hand over to the next generation in layman's terms. But here in diabetes, the legacy meaning the level of glucose that remains under control over the number of years is what results in prevention of the complications of diabetes. It could also be a bad legacy, meaning if you have had uncontrolled sugars for more than 10, 12 years, risk of diabetic nephropathy, retinopathy, heart attacks, strokes, everything definitely multiplies. So it is the number of years that your pancreatic beta cells are soaked in high blood sugars is what causes the cells to go undergo early cell death, apoptosis, what we call, and eventual permanent irreversible diabetes. Now, this usually what happens in people in the age of 40 and 50 with the current affluent lifestyle. If people are not aware enough, the health checkups do not happen unless they have been asked by their office or the company to get it done, or if there's a health scare, that's when they take it seriously. In fact, most people who come with type 2 diabetes usually have some complications already set in because the biological age is different versus the diabetes age is different. So if you do a screening at the onset of diagnosis of diabetes, people may have some changes. So definitely you've lost those 3, 4, 5 years, whatever the patient was having it earlier. That is why early intervention matters, because if you are looking at the beginning of the, if you can say the onset of diabetes or pre-diabetes, aggressive intervention measures, including lifestyle, calorie counting, monitoring blood sugars, looking for the other comorbidities, monitoring the sugar, the thyroid, lipids, etc. Once you become accountable and serious about it, and you put in that effort, it is definitely possible to nip it in the bud. So yes, it is a stitch in time.
And you were mentioning about the consistent follow-up, monitoring, and guidance. So maybe a little more advice to people on, as you say, this happens very often. So especially when people are young, at the most, they might have a health check because it's part of their contract or it's part of their corporate program or something like that, and then they don't take it seriously. So how do you think these people, like in case they do come with some kind of a early marker, you were talking about monitoring, follow-up, and guidance. So how does somebody, do they have to, immediately see a specialist, or is there some other kind of way in which they can take it forward?
Actually, it's a very important area of intervention, and I think here is the place where health checkup consultants who are handling the health checkups have a very important role to play to emphasize, in fact, definitely re-emphasize the importance of timely intervention and regular follow-ups. Also, a lifestyle consultant or an advocate for lifestyle changes who could do hand-holding in the first few years or the first few months at least, till the patient gets it in his DNA to get the exercise and the diet more active. And it is not just a one-time thing. It requires follow-ups and reminders. Maybe, a reminder from the place where the health checkups are happening. And also the patient could use some applications or apps which could have a chatting system to and fro, where they could be accountable. They could, probably put in the data about their meals and the calorie counting, and then they're watching their sugars. So all these things are important. In fact, human behavior is very unreliable about these things, especially when things are not at stake so much and when the value of it is not very much evident, because there's no gross injury or illness at present.
Exactly.
That is why the role of doctors who are handling health checkups is of paramount importance, not just the doctors, but the entire team, who could probably send them friendly reminders and also remind them about not just the lifestyle changes, also the next follow-up that should be there. So definitely this is something which could be done on a regular basis. And since time is always an issue, so AI application using all these would definitely be of extra help, especially with the new generation who is taken to AI very easily. So that's where, again, these things matter.
So I think where you do your health check and what kind of post-health check counseling is available is also equally important. One final question before I leave you. So somebody in their early 20s or even early 30s, it's, I know, difficult to kind of, we've spoken about this and, they don't take it so seriously. But the reason is they say that, oh, I am too young to worry about all these risks. So what would be your quick advice to them? if they say things like this?
Actually, sometimes counseling may not help, but probably some scary data may probably awaken people who are probably sleeping about this. Yes, just to quote, yesterday I've seen a patient who's a 32-year-old who came with triple vessel disease. He had come with an acute myocardial infarction, and he wasn't aware till that very day. His sugars were high, thyroid deranged, lipids abnormal. So a 32-year-old coming with an acute myocardial infarction, angiography showing a triple vessel disease is definitely a sad thing to happen, especially when you have entire productive life ahead of you. And in fact, we always know that once there's an episode of an acute coronary event, the lifespan definitely is not going to be at par with that cohort, that age, gender, etc. So sometimes it's important to understand that it is not always "it won't happen to me" attitude which is going to work. If you see cases around you, you don't have to be the next statistic. It is best to be cautious and aware and taking that extra effort, especially because we all have become very sedentary and our food choices have gone really down. So
Yes.
they should be probably, it has to be ingrained, and this probably will require not simple discussion, but maybe informing real life cases, taking that extra effort. This is again depends on the doctor who's handling these health checks, who should take that extra effort, I feel.
Okay, thank you, doctor. So I think the clear messaging is that disease is happening earlier, and there are signs which come even earlier, and you have to take it seriously, have your screening, and early risk does not mean inevitable loss of quality of life and productivity. If you take steps, you can reverse it. And I think when you identify disease early, these things are very manageable and reversible as well, in most cases. So I think my advice to you, dear viewers, would be to actually to download our Health of the Nation report 2026 and go through all of it because it's real data. It's about people like you, people in India, people in your region, people in your geography. So do go through it and understand that the whole report is a large report with many, many aspects of health discussed in it, and it will help you to rethink how you approach health and your productivity and your well-being. So you can download this entire Health of the Nation report on our website, apollohospitals.com. The link is in the bio. For YouTube, you can download the entire report on our website again, and the link is in the description. So thank you for joining us. Thank you so much, Dr. Vaishali, and do go through the report because the health of the nation is also your health. Thank you.
Thank you.